Hi, my name is Carol Ann Tutera. I'm the CEO of SottoPelle, and our mission is to help people age gracefully from the inside out. The main reason people call one of our SottoPelle offices is because they know something's not right. They know they're out of balance, but they can't put their finger on it. They may have had a doctor tell them, well, just live with it. As they're aging, they're finding the body is changing. So some of the symptoms might be gaining of weight, they're moody and irritable, lack of energy. They're forgetting where they were placing maybe their keys. The women are having night sweats. The men are having challenges building muscle. And they're just not the person they used to be. They really want to come back to regain themselves as they were back in their 30s. Some of the patients are reporting back to us that their benefits include more vitality, mental clarity, feeling better. They enjoy getting up in the morning and going to work. They are able to lose weight because they're exercising more frequently, that they're really starting to feel more like themselves again. SottoPelle therapy is also for men. Men are now realizing and accepting of the fact that they do have a problem. We discovered the importance of pellet therapy in those who have Parkinson's and those who've had concussions, such as those experiencing TBI. One of our prominent ambassadors is Jim McMahon, who played with the Chicago Bears for a very long time. Before he had pellets placed, he was lethargic and not getting out of bed. Once Jim McMahon was treated with pellet therapy, his life changed. He was vital, stronger, traveling on his own, doing a lot of interviews, and truly enjoying life as it used to be for him. They brought a great benefit to him and many others who we've worked with in the Hall of Fame Classic Football League because of concussions, and they found that one in particular of our players, as soon as he had the pellets placed and they got into his system, he felt like a different man and was very happy that he came to see us. We are finding in our offices that women and men are coming in a much younger age now. We've had patients come in as early as their 20s who've had lack of hormonal balance. Our oldest patient was in their 90s because she wanted the energy to get out of bed, and she realized that testosterone was missing in her life to help her achieve that. Throughout the years, we've seen a tremendous change in this industry of physicians providing pellet therapy. There are many in the field who are learning how to do pellets simply because they're jumping on to the next train and feel that it's one way to increase their bottom line. I'm not going to go to a dentist for plastic surgery, so why would you go to a hand surgeon to be treated with pellets? Make sure you're seeing someone who's been trained properly. Make sure you're being treated with lab work before having the pellets done. Make sure they're seeing someone who has the technology behind them to help with the managing dosing of patients. We find that the majority of people stay on the pellet therapy as long as they want to feel good. And they realize that once they come off it, or they find if they go to another office because the price was cheaper, that they end up coming back to us because they want to feel good. So I tell them it's similar to a car. If you want your car to keep running, you've got to keep putting gas in it. So as long as you want to keep aging gracefully, you need to keep the hormone levels at a nice steady state. I've seen many patients come and go through our offices, and it's extremely rewarding to see someone when they come in, when their face is lifeless, they are droopy shouldered. After the treatment, when we see them for a post-checkup, maybe 6 to 8 weeks later, they can't wait to come in the door. Their face is brightened up, their skin looks better, they have a smile on their face, they've got a pep in their step. That to me is what's really rewarding, to see how people's lives are changing.